My name is Kris Gethin, and what I aim to bring to you is inspiration, motivation from clients, everything that will allow you to evolve as a human being. Hello, everybody. This is Kris Gethin. Welcome back to the Kris Gethin podcast. Now, we are not in the studio today. We're on location in Tijuana, Mexico. As some of you know, that I had been planning on coming here a long, long time ago, and that day has come. I am here at the CPI Institute to get stem cells. I did have an IV a second ago. Our beautiful videographer, Sunshine, is hooked up to IV as well. And Scott Nelson is hooked up to an IV here as well. Thank you very much for having us here, my friend.
Thanks for having me, buddy. Appreciate it.
So you are the owner of this facility.
One of the owners.
One of the owners of this facility. Now, I understand that you come from a very competitive background. I can see with your cauliflower ears that you do a little bit of jiu-jitsu and mixed martial arts. Now, I understand as well, obviously, there's a couple of people here that very famous wrestlers and whatnot, and I've seen a lot of UFC fighters come down here. Is that how you got into this space? Because you were dealing with injuries yourself and you research stem cells?
Sort of, but it's a roundabout story. So, actually right now we're in Chipsa Hospital, CPI. We actually have an outpatient facility over there on the beach that we would normally use, but because of kind of the crazy stuff with COVID and things and the restrictions, we brought everybody into one hospital. And I've always been interested in stem cells, like just about any athlete that gets beat up or gets hurt. But came about to it a little bit of a more roundabout way. So here at Chipsa Hospital, we use different cellular therapies to attack cancer. And so it turns out that training a dendritic cell to attack somebody's cancer is actually much more difficult cellular therapy than creating stem cells for people's injuries. And we work with a lot of the top cellular therapists, doctors, and scientists here on our cancer mission. And one of them, named Dr. Tom Ecom, when he was on our scientific advisory board, started to see a bunch of MMA guys coming down here and was like, hey, by the way, I have access to the best stem cells in the world if any of those guys want them. And of course, our ears perked up, right? And we're like, yeah, sure. And, he got us introduced to Francisco Silva, who is one of our business partners here. And we started working with him using his patented hypoxic mesenchymal stem cells. And so it was kind of a roundabout way that we ended up doing anti-aging, joint repair, things like that, because we're really mostly focusing on eradicating people's cancer.
Right. Okay. Got it. Now that's fascinating because we've seen an increasing amount of people that's getting diagnosed with cancer. Mm-hmm. I remember as a kid, I'm 47 now, but as a kid, I didn't really know anyone with cancer. Now it seems like everybody's relative. We know someone with cancer. Our DNA hasn't changed. Our environment has definitely changed
a lot.
So, the therapies have to change to keep up with that. Now, coming from a sports-specific background, obviously I've gone through a lot of injuries myself. What sort of people do you have coming here? Is it mostly sports athletes or people that use this as a preventative measure, knowing, okay, I'm possibly getting into a sport here that I know that could raise issues in the future, like Dominic that's here. He's only in his early 20s, but he's kind of thinking ahead for the future. Do you get a bit of a 50-50 split, or is it mostly people, I've got a lot of injuries here, I need help?
It's mostly people that are already injured. We do get some people that come down for preventative stuff, anti-aging. Right now, most of our clients are, combat athletes or athletes of some form or another. But that's mostly because of our network of friends and people. So myself, Ed Clay, my business partner, both been around the mixed martial arts world forever. I started training jiu-jitsu in 1995 before anybody knew anything about it. Ed was very early. At one point, he was ranked third in MMA in the Shuto organization out of Japan. And so we see a lot of that, but we see a lot of other people. We get a lot of poker players that come down here. We get a lot of DJ type guys that come down here. Some people use this more as like a detox, type of thing while they're here. And we get a lot of athletes that come before competition because they just want to be at their peak. So as you probably know, about 40 to 60% of the IV stem cells end up in your lungs. And so they heal up your lungs. So anybody who's exercising and their sport requires them to breathe a lot, CrossFit guys, different people like that will come down here to get that healing of their lungs. So it'll eat up the scar tissue, the inflammation, and heal up the lungs. So the more oxygen your body gets, the better healing you get, but also the better endurance that you get. When I do the IV stem cells, I literally feel like I got a Jiffy Lube in every joint in my body, like this. Some of the popping, cracking. I'm 52 or pretty close. That really just goes away a lot from doing the cells pre-competition.
Right. Okay. Interesting. Now, and there's been a lot of studies that have come out, especially with a lot of the, like the biohacks that you have here. Like I know there's a study that came out with hyperbaric oxygen just a couple of years ago, showing that it can actually help reverse aging by preventing the shortening of telomeres.
Yes.
So I guess, going through that kind of detoxification process, all these biohacks that you have that accompany the stem cell procedure that you do here seems to be very unique. Now, I've done a lot of research in places in Costa Rica, in Panama, different places, but I've never seen a place that, okay, now we've got PEMF, then hyperbaric oxygen, we do the ozone IV therapy and the NAD and blah, 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 just one after the other. Is this place unique to all of these modalities that help stabilize or proliferate the stem cells?
Well, I can't speak for every one of the other clinics that are out there, and a lot of them do a lot of great work. You mentioned Panama, the place in Colombia, they do a great job. I don't know a lot about the place in Costa Rica, but I know people have gone there and been very happy with what they do. I would say the biggest difference between what we are and what they are is we're cancer fighters, number one. And so what we've been able to do is take a look at what takes a stage 4 cancer patient whose body's been wrecked by chemo and radiation and brings their immune system back to life, kicks in their own natural healing response. And we're applying that to athletes like you. So the IV ozone, for instance, why would we want to put tens of millions of brand new stem cells into your blood without cleaning your blood out first? Let's get rid of the parasites, pathogens, bacteria, anything that's in your blood before we put those cells in that might be harmed from them. Not to mention hyperoxygenating your blood is only, again, going to improve your healing response. Same thing with the pulse electromagnetic field. So by using that before we treat, especially an older injury, we can create a natural healing response in the body. So if it's on your knee, if it's on your shoulder, and that energy is going in there, it is telling your body that I need a healing response here. So we're waking up your body to those old injuries. And the whole goal is, how do we get the best healing response possible? Well, if we use what we use on a cancer patient that gives them a full body healing experience, how's that going to hurt you, right? It's not. It's going to make the process and it's going to make the healing, in my experience, a lot more powerful. We do have that giant hyperbaric oxygen tank. You don't see one, an 8-person. I never put 8 people in it. Usually it's 2 to 4 people in there. You can lie down. Some people get claustrophobic. You won't get claustrophobic in that big tank. And again, Sergio, who runs our hyperbaric, he has a lot of experience. Cancer patients, we can take you down on a much deeper dive by pressurizing that oxygen. It actually goes through your skin. It goes into parts of your body that don't have a lot of blood flow. So the disc in your spine, in your knee, in your shoulder. Again, the goal is, how do we kick in that immune response? How do we give your body all the oxygen it needs? Using the Myers cocktail, like if your body doesn't have all the raw materials it needs to rebuild a knee, a disc, a shoulder, whatever it is, then it's not going to work. So we want to give you all that into your body and everything that you need to get that healing response. We also have found that most of our friends that come down here, they might have been knocked out once or twice. So the hyperbaric oxygen is great for traumatic brain injuries, anything like that. Also the NAD is really good for that. So I do feel like we have a unique program. We also have our own compounding pharmacy. We have our own cellular laboratory here. So we're making everything in-house. So our NAD is usually about 2 weeks hot off the presses. And I don't think other places have that ability because they're not a full-fledged hospital with the compounding pharmacy, with a cellular lab like we are. When people come in here, your first day, we ran full blood panels on you. Why? Why not? Because we can. We do all of our blood testing in-house. What if we find something? And it's happened. It has happened before. We've had people down here, and we've been able to give them a real jump start into getting better because they had no idea they had an existing condition. It was only because they came down here to get stem cells and they ended up getting their blood work done. It's like, oh, I didn't know about that. I think it's a great program. Are you enjoying yourself?
Yeah, I think it's absolutely phenomenal. Like, I've been exposed to a lot of this in the past, through education. I love researching this sort of stuff. Like, at home, we don't have the commercial grade, but, we have the PEMF, the infrared sauna, hyperbaric oxygen, but that's in a soft shell. Like, that HBOT machine that you have here, I've never seen anything like it in my life. That thing
costs a little money.
Yeah, I should imagine. I was like, wow. That is phenomenal.
I love it. Like, when I get out of there, man, I'm ready to fight anybody. Like, you know what I mean? Bring it on. I'm ready to fight the UFC champ. So the hospital was originally reopened to treat Ed's mom, and she had rheumatoid arthritis, and she was dying not from the disease, but dying from doing what's called failed standard of care, which meant they threw everything they possibly could at her. None of it worked. Actually made her sicker. That was the original reason. She was our second patient here. She's been in remission now for 6 or 7 years. She came in a wheelchair and left walking. And when we reopened the hospital, it was the original Gerson Hospital. Dr. Max Gerson, his daughter opened the hospital about 42 years ago. And so when we reopened the hospital, luckily enough, we were able to get a lot of the staff back. And at that time, had opened it to treat people for ibogaine and for autoimmune. And it had such a rich history of cancer, and the doctors all wanted to work on cancer patients again. We just expanded out and started doing that as well. It ended up really becoming our primary focus. When somebody is given 0 options at home, we get patients from all over the world, and they still want to fight. We want to give them a shot to fight. We're all fighters, and we organize our hospital like a fight camp for the cancer patients. We have mental coaches, we have psychologists, and a lot like an MMA camp. If you're going to fight a karate guy, you better have the best karate guy you can get to train you and the best anti-karate guy to train you. So in the same boat, we have traditional oncologists and we have homeopaths. We have traditional MDs and we have naturopaths. We have a diet person here for them. And we work a lot on the mental game of the fight and really creating a whole team around each patient. Everything we do here is a little different than most hospitals that you go to. We really try to make it not feel like a hospital here, more like a hotel type experience. And the number one rule of thumb that we have for all of our doctors, all of our staff, is treat that patient how you would want your mother or father to be treated. So when in doubt, how would you treat your mom in this situation? And treat our patient exactly like that. And if that means breaking a rule or doing something that's not normal, then okay, it doesn't matter. If that was your mom, this is how you should treat that patient.
Yeah, and we've definitely noticed the professionalism, the hospitality, just people being really kind and helpful. Like, I got to go to the dentist today. That was unexpected, but the nurse down there said, let me make some calls. I'll get you booked in.
Right.
So it's very, very kind. Very kind of them.
I think that says also a lot of that is the Mexican culture here. The people here are very, very kind, very caring, very family-oriented, and they really get it. It's a unique place to work because it doesn't work for everybody, and we're working hard every day to make it better, but it doesn't take too many people that you see come in that we're told to go home and die or come in a wheelchair and just a few weeks or a month later leave walking with their life and their family back, and the ripple that causes with the people around them. So we're very proud of what we do, and our staff works really, really hard.
That's awesome. And I did a lot of research some years ago on the Gerson therapy and read about the family history and everything. It just seems ironic that we're here. Like my father, he had cancer a few years ago. He recovered. I did a lot of research and really, coming across the Gerson therapy. And I remember researching to see where there were places within the UK and within the US, but obviously they couldn't practice there. And here we are.
Yeah.
So one of the questions that I get asked all the time, and I'd love to get your professional answer from various aspects, people say, but I can get stem cells in the US. Why on earth would you go to Mexico to get your stem cells?
Sure.
I'm sure you get that question as well.
Day.
So could you answer the difference between the stem cells that people would get applied here and costs involved in comparison to the US?
Sure. Well, I'm not a doctor, so I'll do my best on that. But America's behind the times in healthcare everywhere. If there's anything that COVID has showed us, it's how broken our medical system is. So Francisco says that we're 10 to 15 years ahead of what they could do in the United States right now. Basically, the stem cells that we are using, they come from the umbilical cord, and they're grown, incubated, and expanded in hypoxia, which means that they don't need a lot of oxygen to live.
And over what duration are they cultivated? Like, is it like a couple of days, a week?
Oh, how long the actual process is? I think it's about a week, but honestly, I don't know. That's a lab person.
That's what I've been told. It's like a
yeah.
week, but you have to do less than 24 hours in the US.
Yeah. Some other things that we do is that Francisco has a process called cleaning the cell, which makes it more bioavailable. We're also using, one of the old styles would be the stem cells in the Wharton's jelly. And all of those stem cells are good. They work. I've done them. It's just an older technology. The problem with that is that the stem cells that you're getting, you're not just getting the stem cells, you're getting whatever else is sucked out with it. And no two of those stem cells are the same inside that injection you're getting. Whereas the injections here, Francisco has so much experience and done so many different trials and different things, is that he has different lines of stem cells. And those lines of stem cells have been tested over and over. So they've done like over 1,000 backs. And he knows this particular stem cells have shown the best results in discs over time. And so we have different lines that we use. There'll be a different one if we're doing something for a different organ or something. Francisco is one of the few people in the world who can actually grow the stem cells for the heart, where you look at them underneath a microscope and you can actually see them. And like I said before, our real mission is eradicating cancer for people, and to expand a cell out that is trained to attack a specific tumor in somebody's body is a much more difficult thing. Down here also we're able to use the lysate, which does a couple things. One, it holds it into the joint. It actually turns them into a jelly. So we have a limited amount of time to get them out of the syringe and into your elbow, shoulder, knee, whatever you're doing, before it gets too thick, and that holds it in place. As you can imagine, your joints, they don't like a lot of fluid in them. So the old style, where they're much more fluid in a saline solution, as soon as it goes in there, your body is immediately trying to push it out. If the stem cells aren't hypoxic, there's not a lot of blood in your joints, especially not in a disc, so they die quicker. The lysate is also very thick for discs, so it pushes to the outside wall of the disc, and it thickens and strengthens the wall of the disc. And then the growth factors. Growth factors is like a fertilizer that is helping the cells turn into the type of cells that we want them to become. So there's some famous cases. A woman got plastic surgery and got stem cells put under her eye, and instead of turning into what she needed it to, it turned into bone. She had like a unicorn bone. There's another guy who got him in his knee. Instead of turning into cartilage and what we needed, it turned into fat cells. So he had to have even more damage done to his knee to get his knee scoped out. So those stem cells that you can get in the US, they're good. They're just an older technology. And what we can do down here in Mexico, we have special licensing for our lab. We have special licensing because we are a cancer research hospital that allows us to do things that people can't do in other places.
Yeah, like speaking to Ray earlier as well. He'd had stem cells in Costa Rica, and he said, like, when he had the stem cells injected into his knees, into his shoulders, they weren't using like an ultrasound.
Really?
They weren't using an ultrasound to see exactly where that needle should go into the AC joint or into the tendon.
Yeah.
It was just kind of blind faith, I guess. So that's something that is a little bit different. I don't know if they do that in the US, but overseas, you're actually using an ultrasound based on the MRIs and the X-rays that you've seen to actually guide the stem cells to a specific area.
Yeah.
And when it comes to these stem cells as well, can you administer like more of an efficacious dosage here in comparison to, say, the US?
Yes. Well, just one, being able to get that many cells, right? So stem cells that come from the US, you can only get so many cells out of the Wharton's jelly, and there's only so much you can put into a shoulder or to a joint. And again, you're getting an estimation of how many cells they are. When we expand the cells out here, we know exactly how many cells are in there. We actually overfill just in case there's a little bit of die-off or anything that's in there. So there's usually an extra 2 or 3 million extra cells in there. Also, we're producing all of our cells right here in Mexico, just a couple of blocks away. They're not sitting in storage somewhere or being transported from one place to another where they could get damaged along the way. One of the things I think that is an advantage for us, again, we're a cancer hospital. Our specialist who's guiding that ultrasound, doing those injections, is one of the best, because he has to be. Because what his real job here is, above just putting it in someone's knee or shoulder, is we have to do guided injections into tumors. And tumors are extremely vascular. And so if you happen to pop that or something like that, a patient could bleed out. So he has to be very, very precise and very good with that ultrasound going into a tumor. Now, all of a sudden, going into somebody's shoulder and finding that exact spot is much simpler. So he's very, very experienced in what he does. And like you were saying, Ray had said, most of the people that have come down here have commented if they've gone somewhere else, they felt like there was a lot more time and care given to the placement. And I believe that it's, one, we really care, but also the experience of doing it for cancer versus an athlete. It's just, we have to be at a little higher level than somebody who's just doing, orthopedic joints.
Yeah. With your experience, when you've had injections before, have you, like in your knees and whatnot, have you always had them here, or did you previously have them elsewhere? And what was that experience like compared to obviously having them at this facility?
Yeah, I've done stem cells that wasn't here beforehand, and I had a good experience. I've always gotten a good healing response from them. I think one of the reasons why people get a better response here, and some people get a lot more inflammation and a lot more painful, could be stiffer. Every person is different. And honestly, that's not necessarily bad, because we do want the body. So when we're putting the stem cells into a joint, we're kind of fooling the body into thinking you had a major injury because you're having that swelling and that fluid in there. And that, again, tells your body healing response, immune system kick in, go heal in that area. I do think that, like you were talking about the other place, that maybe they didn't use it, or some places that do use ultrasound, they might not have as high a level doctor doing it. So we have to be a cut above. We have to be better. So because we are a cancer hospital, because putting immunotherapies directly into tumors, we have to be so much more specific than, say, putting some stem cells in your shoulder. Because of that, the first time I had my knee done with these type of stem cells here, we just had an orthopedic surgery do it. It was a little bit painful. I wasn't really happy with her. That's why she's not back. You have to have such a delicate hand to maneuver this tiny needle through a tumor that now it comes time to do somebody's neck, back, shoulder, or knee. Every day you're working with that type of a skill. You're not going to just throw that away and forget about it. Oh, this is just a shoulder. Now I can be a little careless or a little rougher. Cancer patients are usually in a lot of pain, so we need to take care to create as little pain for them as possible. We try to use as little painkillers here as possible and anti-inflammatories. And, they're available if somebody needs them, but we really want people to have the best experience possible.
You kind of want that inflammatory response for the stem cells to go and hone in on. Now,
which is why you got to get on the PEMF after you do your stem cells.
Right.
As well. Yeah.
And what is the reason behind that? What does a PEMF do?
So pulse electromagnetic field, it shoots a pulse of energy into the body, into the cells, and it does two things. It puts energy into the mitochondria of the cell, which is like the motor of the cell, so it's bringing dying cells back to life. But it's also vibrating the cells at the same frequency your body naturally does when your cells are replicating. So that cell replication is almost like creating a new stem cell, right? You're creating your own stem cell. But what I found on old injuries, like this before I had the stem cells in my back, this was the best thing for me for my back, is it just creates a healing response. So if you have a lot of injuries like I do, you hurt your knee and then you hurt your elbow and your body forgets about healing your knee because it goes to focus on the new injury. That's why I think it works so great on old injuries. Is every one of those little pulses, dunk, 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 that's going into you is telling your body like heal right here, heal right here. It just seems to work really well with the stem cells. Our cancer patients love that machine because, again, they're in a lot of pain, and they can go take, a 8-9 pain down to a 3 in 20 minutes with no drugs whatsoever. It's also very good for nerve damage. I had a lot of nerve damage when I broke my back, and a lot of people that come down here have sciatica problems, different nerve problems, a lot of numbness from neck injuries. That puts energy down the nerve, and it's what I've been told is called straightens the nerve. So it forces the energy down the nerve, which corrects the energy flow in the nerves, which takes away the nerve pain.
We absolutely love the PEMF, right? Like, we don't have something at home, much like what you have here in the clinic. We've got a home mat device, but it's absolutely phenomenal. I've used that through several injuries. Mm-hmm. Sunshine uses it for sleep mostly, don't you?
It's good for that too.
I know the answer to this, but maybe you can share a little bit more. If you're getting stem cells in the US, for instance, I know there's various forms. You're not going to get the efficacy that you're going to get here. Some people do bone marrow extraction and get their stem cells put in that way. Do you know the price comparison what the US charges, let's say mine cost $20,000, what I would be paying in the US for the similar thing.
Right now, legally, you can't use the type of stem cells that we have, the expanded stem cells. And stem cell pricing is actually all over the place in the United States. I was recently told about a guy that allegedly does stem cells for $1,500 in Vegas. And I'm just thinking to myself, like, what are you going to get for $1,500? Like, do you really think you're going to get the best bang for your buck? When you what I know is you start trying to compare, like, the number of places. So myself, most of my friends are people that are beat up. There's a lot of places that charge per injection site. And so, like, if I try to do that, how many sites did you get injected?
I got 3, but there was several points of injection within some of those places. So, for instance, in my shoulder, AC joint and supraspinatus. So there were several. And then I had my face and hairline.
Right. If you had 3 different joints, I've heard of places that charge an extra $1,500 to $2,500 just to access those areas. So again, a lot of my friends are MMA, jiu-jitsu, Muay Thai fighter people. If I'm going to charge them an extra $7,500 just because my doctor is moving from one spot to another, like, it just doesn't make sense. So we don't charge any extra. Only if I have to bring in a specialist for a spine, a neck, for interthecal, anything like that. That included with the volume of cells, like the number of cells that we can get, it seems like to go to a reputable place in the United States, you're looking at minimum double, sometimes triple what you're going to pay down here.
Yeah, that's exactly what I was quoted.
Yeah.
So it's over double. And obviously, like you said, it's comparing apples with oranges. There's different types of stem cells as well. And the way that I see a lot of those stem cells that you mentioned before, you have stem cells specifically for injuries, stem cells specifically for tumors or whatever. It's kind of like peptides, where you have these sequences of amino acids that are specific for that target response that you're trying to obtain. Yeah, I guess it's along the same sort of way. Now, what is the downtime? Obviously, like, I'm an athletic person. I like to do a lot of running. I'll do Ironman triathlon. I do ultra marathon. I also weight train a lot. I'm like a bit of a hybrid athlete. Now, what would be the downtime of me after the stem cell procedure to get back into 100% training? And how does that look like? Is it something that you scale with the intensity over a certain period of time?
Well, I'm not the boss of you. So you could technically, we didn't change anything structurally or damage anything structurally. So technically you could go back and start training right away, which frequently a lot of the athletes that come down here do. I suggest taking at least 30 days off. If you talk to the doctors, they'll probably tell you to take 90 days off, because that's the type of stem cells that we have shown to continue to have a healing response for up to 90 days. That said, I don't practice what I preach. So after I got my back done, within about 45 days, I was feeling so good. I mean, if you would have seen me before I got my back done, my nickname was Old Man Walking. I couldn't walk down more than one stair at a time. I had sciatic nerve pain almost every day of my life, at least 5 out of 7 days a week. And the things that I could do in my life were really gone, and I felt so good. I jumped on an electric skateboard and started ripping around the neighborhood. Ed, my business partner here, is like, you need to calm down, but I ended up crashing, tore grade 2 meniscus tear, half my PCL, but I fell flat on my butt so bad I had 2 big bruises on my butt and road rash on my butt, and I thought for sure I'm going to wake up the next day, I'm not going to be able to walk, because I would have days where if I hurt myself, if I lifted anything too heavy, the next day that the sciatic pain down my leg would cause cramping in my calf and force my toes to point, and it would take me a long time to straighten my foot back up. Woke up the next day, no back pain, no nerve pain, nothing. So people are like, oh, are you worried about your knee? I'm like, I don't give a crap about my knee. I don't care how bad my knee hurts. It's nothing like back pain. So I tell people, give it a good month. Make sure you don't drink alcohol. That's especially bad, but people need to feel it out. We had Rafael Lovato Jr., Bellator champion, super famous American jiu-jitsu guy. He said in 7 days, man, he felt better than he'd felt in years. And jumped right back on the mat training. Within a month, he had won the Masters division of the World Championships at black belt. Again, so athletes, I notice, they know their bodies better. They seem to react a lot better and feel better quicker than people that kind of come down here. Maybe they're professional. We had a lot of professional poker players and people that like the NID for the focus. They don't seem to feel the effects as quickly. And it's different from everybody. I had a former professional rugby player come down here. I mean, we injected like everything on this guy. I was telling him, hey man, we should break this into 2 trips. He's like, nope, ankles, knees, elbows, shoulders, everything all in one trip. Surprisingly, he walked out of here. I thought he was going to be in a lot of pain. He wasn't. And he called me complaining for about 2 months. I don't feel anything. I don't feel anything. And I'm like, I don't know, buddy. Like, I'm not sure why you're not feeling anything. And then about 90 days into it, he called me up. He's like, I feel amazing. He's like, I don't know what happened, but it really started to work for me after about 60 days. And he actually hit me up. He wants to come down and do his low back now. And for some reason, he just had a delayed response, but he had a really good one. So he's back riding mountain bikes all the time. He's super happy about it.
Yeah, that's what I've noticed as well. You've got fast responders and you get slow responders. Sometimes it can take up to 6 months to get the full efficacy. So you just got to be patient during that time and know that the healing is coming.
And one thing that people should take into account is that whatever new inflammation you're creating, the stem cells are going to go after that first. There are guys I know that they come in, especially like mid-fight camp or something like that, or a couple weeks before a competition that they're going into, and they're looking at it as different than to try to heal a specific injury. They want to get super good gains in that month before competition. So they'll come in and they'll do the stem cells, and then their ability to work out harder, train harder, like I said, especially in the lungs, their gas goes way up. There are guys that come down here and they're training the very next day. They're in here for a different reason. They're not like, oh, I have a bad knee, I need to heal up. They just want that extra step up that they're going to get in their training.
Got it. So if you do have an injury, you're better off taking it a little bit easier because you don't want the stem cells to go to that new trauma. You want them to localize in the area that you're trying to heal.
You got it, yeah.
Okay, awesome. Well, thank you very much for your time here.
Sure, buddy. Glad you guys came down.
We're really enjoying it. Yeah. We're really enjoying it. It's phenomenal. So if anybody does have any questions for me, of course, you can ask them in like the comment section or reach out to me on Instagram. However, if anybody wants to reach out to this facility directly, where should they find you?
Sure. You can find our website at cellularperformanceinstitute.com. We're CPI Stem Cells on Instagram or Facebook. If people want to send me a DM myself, I'm happy to answer any questions for people. I'm at Scotty OTM, which is on the mat. So SCOTTY OTM on the mat, which is my old martial arts company. And just, hit us up. We're happy to answer questions. We offer a free doctor call for anybody who's interested. And just trying to help and support as many people as we can.
Awesome. Thank you very much. And of course, we'll put the Instagram and links in the show notes there, so be sure to check them out. But thank you ever so much for myself and Mr. Scott Nelson. Really, really appreciate you. And we are out until next week. Thank you ever so much for listening. My name is Kris Gethin, and I am out.